Hello once again. Welcome to our webinar this evening. We are really glad you could join us and take a little bit of your time to be with us this evening. We are going to start this webinar on mental health and well-being. We are really glad that you could join us. I'm going to introduce myself first and then have my colleagues introduce themselves as well. My name is Paul Castellino. I'm the Director of the Counseling and Psychological Services. I've been here for a little while, so almost 14 years, and I really enjoy being at Ohio University. I came as a psychologist and have been a clinical director and now the director. Thank you for being here. We'll be spending this hour with you.
My name is Sam Christopher. I'm training director at CPS. I'm a staff psychologist as well. I've been at OU CPS since 2019. However, OU is not new to me. I did my undergraduate degree here a while ago, and then Athens is home. So I ended up coming back and really grateful to be able to give back to the community that gave me so much. Yeah, and I'm also really glad to be here this evening to share a little bit about our services.
Hello, I'm Stephanie McCombs Hunter. I'm the Assistant Director for Outreach and Consultation at Counseling and Psychological Services. I started at CPS in 2019 as well. And I'm also not new to OU. I did my bachelor, master, and PhD programs here. So I'm really familiar with campus from both perspectives, student and employee. And I'm local to Athens County as well. And I'm happy that you're all joining us tonight.
And hello, my name's Chad Wilt. I'm one of the staff counselors here, and I'm just going to keep the theme rolling. Also an alum, undergrad. I did back here and graduated in, seems like forever ago, but 1994, the music ed degree. And I've been back here for about 2.5 years now. And in addition to working here, I also have 2 kids going to school here as well. So I understand the parent side of things as well as the employee side of things. So welcome and thank you for taking time out of your day to come and spend that with us here.
Thanks, Chad. And we have Megan Vogel with us, who is really helping us with this webinar. She's been instrumental in setting this up and really appreciate her time and effort in facilitating this. We can move on to the next slide here. So CPS, or the Counseling and Psychological Services, is a part of the bigger well-being entity that exists at Ohio University. The mission of our Ohio University is that of the student affairs is that we care, that we are really into student well-being. We educate and empower. We foster inclusive communities, and we make Ohio strong. That's our mission. That's the mission of the Student Affairs. And that's what we try to live up to as CPS, or the Counseling and Psych Services. As you look at this well-being, sort of the logo, you'll see the 4 pillars. And 4 pillars kind of focus on the fundamental, personal, social, and university-wide areas. And CPS, we as our center, kind of helps to build all those 4 pillars of the students here at Ohio University. In terms of fundamental, we think about health as fundamental to our functioning, our students' functioning. As we think about personal, we think about personal growth, identity development, values, and really figuring out who we are as individuals, as students discovering themselves and their self-worth. And we facilitate that through our services. Through social, we think in terms of the connections we make, the partnerships we develop, and in terms of really building the community. And so we work with our students to foster that. And we really work university-wide in terms of all the resources that are available for students, whether it is in academia or in terms of student affairs, as well as in the community. So really bringing that holistic approach to student development. And that is what we focus on here at the Counseling Center, although our main focus is really students' mental health and their well-being, really focusing on any kind of struggles they may go through as while they are students at OU. I'll hand over to Sam.
Yeah, thanks, Paul. So when we're talking about well-being and our role as the Counseling Center, we often encounter students when they're experiencing mental health crises or in distress. And so it's important to also be aware of larger trends and the ways in which they might be impacting not just college students as a whole, but even your students. So there is a general trend of an increase in college students' reported mental health symptoms. So during 2021 school year, more than 60% of college students met criteria for at least one mental health concern, according to a Healthy Mind study. And then in the past decade, mental health symptoms or endorsement of mental health symptoms have nearly doubled in college student populations. Next slide, thank you. So here we have some data that has been gathered from, was it SAMHSA data? So taking a look at college students, so typical traditionally aged college students, ages 18 to 22. The far left graph, folks reporting suicidal thoughts, mental illness, and a major depressive episode within the last year between men and women in the year 2019. And then also in the middle, or the graph to the right, and this shows the ways in which it's changed over time. And so might be asking ourselves, what's contributing to this increase in mental health concerns? And so a couple of really important things include, this is a really a time of transition for young adults moving to college, independence, adjustment to new ways of being in the world. There's an intense pressure to succeed academically, increased levels of anxiety and depression just globally, rapid evolution of technology, the ways in which we use technology, social media, economic and financial pressures, increase in food insecurity amongst young adults. And also, I think it's important to note the impact of COVID-19 and the pandemic contributing to experiences of isolation, loneliness, and disrupted planning, as well as the impact of COVID-19 on young adults' lives in terms of their own health or the health of their loved ones, contributing to additional stress. Next slide, Chad. Thank you. And so this is data from American College Health Association. And so this is recent data from spring 2022, and just giving a picture of what students might be experiencing. So 52% endorsed feeling lonely, 23% experiencing serious psychological distress, 11% intentionally injuring themselves, 28% screening positive on a suicide risk screening tool, and then 2.5% making a suicide attempt. Next slide. Thank you. And so how the trends over the last 8 years. And so looking at symptoms of anxiety, depression, general stress, relationship concerns, trauma and suicidality. And so although some concerns we're seeing a slight decrease, we do see increases in other concerns, specifically when we look at anxiety, overall stress, and trauma. All right, and so I'm going to turn it back over to Paul to talk more about what we have to offer and how we support students at Ohio University.
Thanks, Sam. Just want to also inform all the participants that if we have questions, there is a question answer tab that you can put your questions down, and we will get to all your questions toward the end, and we'll sure have plenty of time for question answer. The presentation will last about 20 minutes, or say maybe another 10 minutes, and then we will open it up to question answers. So really appreciate if you have any questions, please put them in the question answer chat, whatever that is called. So I want to sort of just quickly give you a little bit of little background about CPS, or Counseling and Psych Services. We are accredited by the International Accreditation of the Counseling Services, or IACS. We provide confidential services. If your student is under guaranteed tuition, then there is no fee involved. Graduate students, professional students have a well-being fee for $45 a semester. Since COVID, post-COVID, we offer both in-person and telehealth services. We consist of 18 clinical staff, psychologists, counselors, social workers. Currently, we have one psychiatric nurse practitioners. Very soon, starting spring, we'll have 2 nurse practitioners working with us for psychiatric providers. We also have a large training program. We train psychologists, counselors, and social workers who wants to be from our programs here at OU, the clinical program, or counselor education program, and social work program. We also have the APA accredited internship program, which is more like a residency. For those who are going on to becoming a psychologist, they have to spend 1 year of residency, and we get matched by residents from all over the country. So we have 3 residents or psychology residents here every year. I think the main focus of our presentation is how your student can access our services. If they need to see a counselor or psychologist or a mental health provider or a psychiatric nurse practitioner, how do they go about doing that? Our focus has been in the last few years to really provide easy access to students so they don't have to worry about coming to see a counselor or a mental health provider. Students can simply drop in or walk in during business days between 9:45 and 3:15 p.m. And we have staff, we have psychologists, counselors staffed during that time to students who will be walking in to meet with them and do the initial assessment and really listen to what's going on and how we can support them. When we are closed at 5 p.m., we also have this walk-in, drop-in services at the Living Learning Center, which is in South Green, in room 160 from 5 p.m. to 10 p.m. And this is a very unique service that is not available at many other universities. This has been an envy of many other university counseling centers that we are able to provide here from 5 p.m. to 10 p.m. Sunday to Friday, 6 days a week during the fall and spring semesters. And this is a very unique opportunity for students who are not morning persons, can't get up in the morning, kind of late evening people. They can always go here and talk to a counselor as well. Besides walking in and coming in person, students can simply call in and with using our main number 24/7 during the business hours. If they call in, there'll be a counselor who will be responding to that call. They might encourage them to walk in or might address their issues on the phone, or sometimes they might schedule a video conference call. after hours, they can press 1 to speak with a counselor, and especially when there is an emergency. If they can wait till tomorrow, and if it's not an emergency, that's great. But if it's an emergency, they can simply press 1 and speak with a counselor. So they don't have to worry about not having to talk to a counselor right away. We also encourage students to call and schedule. Many students don't want to walk in or just come in. They want to schedule when it is appropriate for them. So we encourage them to call and schedule an appointment so they can do that at this point. Talking about our core services, once they come in and we meet with them, we kind of talk to them about, they might talk to us about what's going on and how we can support them. Then we kind of talk to them about the various resources and services we have. Majority of them might end up doing individual counseling. We encourage a lot of our students to benefit from group counseling, which is an unique opportunity to participate in a group. We have any given semester from 10 to 15 groups that we run, and there are a few that are very popular, especially interpersonal process groups. We have support groups and skill-based groups. I kind of talked about the Counsel and Residence program, which is the evening walk-in program. I also mentioned on the crisis services, students can walk in, drop in, or call 24/7. We have a care manager who meets with the students when they need some kind of care management. For example, they need ADHD assessment, and the care manager will meet with them and give them the referrals and information as how to go about getting that. Psychiatric services, we have one psychiatric nurse practitioner at this point, and we'll be adding another one very soon. When it is appropriate, we will refer many of our students to our health services, which is campus care. And we have a very close collaboration, consultation relationship with our campus care. We work with them very closely, and they see a lot of our students who come to CPS for medication evaluation. We offer daily during the week a coping clinic. Students can simply walk in or drop in. Right now it is virtual, and in the future we might even have walk in person, which we used to do before COVID. And they can do that at any day. And there are different topics that we have. Affinity spaces are spaces for special populations. Currently, we have one for first gen. We have one for worthy women. We call worthy women for women who wants to have an affinity space of their own. We have affinity spaces that for LGBT students, as well as minority students that we are exploring the possibilities. And as parents, you can always call us. You can call and consult with us. If you are concerned about a student, you can call that number and say, I need to talk to a counselor and need to figure out what to do with my child. And we are available to you when we are open to consult with us.
All right.
Yeah, thanks, Stephanie. I'll pass this on to Stephanie.
Yep, I'm going to take over now and share about some additional resources that we have. So as students of the university with their email, they can access any of these 3 services for free. The first one is called WellTrack, which is an interactive online therapy app, a self-help app of sorts. It's free, it's confidential. All they need is their email to log in after they download the app to their phone. And in the app, there are several features with just a few listed here. There are some learning modules on a wide variety of topics like management of depression, management of anxiety, and even strategies for managing concentration and focus issues, such as managing ADHD. There's a feature called Mood Check, so that helps students stay in touch with their emotions and maybe become more aware. And there's other things like a Zen room and strategies to de-stress when just feeling overwhelmed, which doesn't involve talking to a therapist or other people. This can be done solo. Another service is Togetherall. which is a free online mental health support community. It's monitored 24/7 by mental health professionals. And what I tell clients are that there are no trolls or bullies in the app, and that they can just talk openly, anonymously, and get the support that they're looking for without judgment, and also provide support to others, which can be really beneficial to students as well. It's a pretty popular option in terms of communicating with other students, but there are also learning features in there as well. Learning modules, again, on depression and anxiety, managing procrastination, and things that are common problems among college students. And then we have online workshops. We developed these during COVID times when we were mostly remote, to give students an option to learn about anxiety and depression from home, and they're self-paced. And we've kept them around to be accessible to students who are maybe a little more anxious to come into the counseling center, or even to serve as a supplement to the therapy they're already getting. So these are 3-hour total workshops, but broken up into small chunks to make it easy to learn and understand. And students will walk away with concrete coping skills for management of anxiety and depression. We also have, through CPS and kind of partnership with Collegiate Recovery Community. So the Collegiate Recovery Community is a special community for our students who are seeking recovery from alcohol or drug misuse or any other addictive behavior as well. And also for students who may be impacted by the addiction of a family member, a loved one, a roommate, or a friend. So at the Collegiate Recovery Community, it's actually outside of our typical location. It's a designated space that is somewhat isolated so that students can feel safe and confidential and kind of able to escape maybe some of the things they might be managing outside. They can drop in between classes, they can study, they attend meetings. The meetings are not traditional 12-step meetings, they are support meetings, so they're kind of accessible and attractive to a wide range of students, and build a fellowship with other students to feel less lonely. So Paul has already touched on a lot of the things on this slide, but we also offer outreach and consultation, where we connect with other care providers across campus, and collaborate very closely with key offices across campus. So some of the ways that we do that are that we have 3 embedded clinicians, one in the athletics department, one in our diversity and inclusion offices, one in HCOM and College of Fine Arts. We also collaborate, as Paul mentioned, with Campus Care, our kind of medical facility on campus, with accessibility services, which is where students would go to get accommodations for a physical or mental disability. Well-being coaching through our campus rec and well-being department. There are a nutritionist that we work with through WellWorks, and then a psychology and social work clinic, which is another mental health resource on campus. We also collaborate with Active Minds and the Body Project, which are 2 student Active Minds is a student organization available to students. The Body Project is a resource available to students who might be struggling with body image concerns. There's a list here of several offices we work with, but there are many, many, many more. And each staff at CPS tries to develop a liaison partnership with another department across campus so that we can connect with your students on a more targeted level and make sure we're addressing any acute needs that arise across campus. And lastly, we have a suicide prevention training called Bobcats Who Care that we provide to faculty, staff, and student leaders to create a culture across campus where it's okay to talk about mental health, suicide risk, and so that everyone that most students come in contact with know how to manage a crisis situation. And again, just to reiterate, to access any of the services we've discussed so far, students can drop in between 9:45 and 3:15 at Hudson 3rd floor, or call the main line, 740-593-1616. They can either schedule an initial appointment or consult with us about what they might want to do. And again, in emergencies, they can call our line 24/7, or in a life-threatening situation, call 911.
Thanks, Stephanie. We are at the last slide here. Again, just to recap everything we said, what to do when you are concerned about your student. I say, first of all, we want you to be in touch with your student, check in with your student. As we talked about the struggles students are going through in day and age, so really trying to be more understanding and kind. As Chad was mentioning that he has two kids in college, I have my first one freshman this year, and oftentimes I kind of tell myself, gosh, when I was in college, I had much harder times, but then of course I don't want to tell him that. Then he probably won't tell me what's going on in his life, so I have to be more kind toward him and his struggles than just to think about myself. So I would encourage parents to think in terms of these are different times. How can we be kinder to them and allow them to come to us and talk about their struggles? Encourage them to see a counselor or any other numerous services that we have on campus that you may be aware of, or call the counseling center just to get some guidance. So we can assist you in terms of how you can help your student or where the resources might be good for them to go to. If your student is living on campus in residence halls, and if you haven't heard from them and are concerned about them, resident director is probably the best thing that you can do to reach out to them and say, I've been concerned about my child and haven't heard from them. And they'll be able to put you in touch with them and figure out what's going on. There is also something that we have called care team on campus. If you are concerned about the well-being of a student, whether it is your child or some other child or a friend's child or your child's roommate, please use that link to inform the Dean of Students office that you are concerned about someone. Basically, what they would do is reach out to the student and try to see if the students need any kind of support. Oftentimes, they will refer the student to come to us, to CPS, or they will talk to them and see what support that student might need. So that's another very useful link, useful way to be helpful to somebody who may be struggling. And as always, when there is an emergency, a real emergency, it's best to call 911 or on campus or OUPD numbers so that they can get them the immediate help that they need. Now, I do want to talk about the dog, since you have the picture of the dog. That's our therapy dog. At CPS, we have two therapy dogs. We have a therapist who has therapy dogs, and the dog's name is Buddy. So we love Buddy, and a lot of students love Buddy when he goes around the campus visiting them. So I just want you to know that's something we didn't include in our slides. We have also therapy dogs at the center. Thank you for listening to us, and we will open up to any questions you might have at this point.
And if you do have any questions, you can use the Q&A feature, which is at the top of your screen, and it looks like two chat bubbles that says Q&A underneath it. And you should be able to click ask a question, type it in, and we can answer for you.
Okay, so there is a question about how does confidentiality work when a parent calls in? I think that's a great question. If your child is over 18 and they're considered as an adult, if you were to call the counseling center, we will receive any information you would give us. We will not be at freedom to say whether your child is a client of ours or not. So we'll not be able to tell you whether they are coming to CPS or they are receiving services. Now you might know, your child might have shared with you, you might tell us that I know my child is coming to CPS and they told me that they are seeing so and so, and that is fine. You can relate any information to us. we just not at that kind of freedom to say that we are seeing them, unless the client, the child has signed a release for us to communicate that information. So we really respect confidentiality. I think confidentiality is at the foundation of counseling. It makes students feel confident and comfortable to come and talk to us freely, knowing that that information is confidential.
Well, it looks like we have another question, which is, what is the cost for utilizing CPS services?
That is another great question, and Sam or Stephanie can jump in as well. So if a student is under guaranteed tuition model, that means there is no cost involved at this point. So they can come to counseling and psych services and receive the services we have. So if your child is a freshman or in a 4-year degree program, which are all pretty much most of them are under guaranteed tuition, there is no cost involved. Now, when we make a referral to campus care or for some assessment or off-campus services, there may be they might bill their insurance. So those services are not provided by us, but any service that we provide that we do not bill and we do not charge a fee. Now, students who are not covered under guaranteed tuition, for example, the graduate students, professional students, and a few undergraduates who may be transfer students or in their 5th or 6th year who are not under guaranteed tuition, then they have the option of paying a $45 well-being fee a semester. Now we are talking about $45 a semester. Now if we are billing, the copay alone would be, each visit will be around $25. So we are talking about $45 a semester, a well-being fee to cover our services. Most students are very willing to pay that. We also talk to our students, and if they have absolutely not able to pay that fee, and we believe genuinely that they have financial constraints, then we will work with them. We'll waive that fee.
Looks like we have another question too on how does it work with community services if my student is taken to the hospital in a mental health crisis?
So generally, if the student is taken to the hospital, I think they may go through ER at Oblenas here in Athens. Or sometimes our crisis team the Athens County crisis team might be able to hospitalize them by bypassing the ER, take them to a hospital either in Columbus or Cincinnati or Cleveland or Zanesville. So it will really, before they take them to the hospital, they'll make sure what insurance they're in. And if the hospital will take their insurance, make sure that insurance can cover their cost. There's always going to be some cost involved in terms of co-pays or sometimes deductibles. The insurance might have a deductible and so forth. So there will be some cost involved in terms of hospitalization, but oftentimes before they got hospitalized, they'll make sure that insurance is covered for those particular places that they'll be taken to. Another thing, I think especially for parents, if a student is going to the hospital, we always check with the student to get their parents involved. Unless the student really doesn't want the parents to be involved, then we will not force them, but we will always check with the student if we can contact the parents or if they can contact the parents about going to the hospital. And oftentimes we work with the parents in terms of going to the hospital or what hospitals they might want to go. Occasionally, we have had parents who want them to go to a hospital Cleveland because the parents are in Cleveland or in Cincinnati or in Columbus and so forth. So we really work with making sure that the parents are involved if the student is willing to do that.
It really makes me think and appreciate the importance of social support when it comes to college students' mental health and wellness. Social support from parents, from peers, and others, and yeah, thinking of how that support can really impact outcome of mental health concerns.
Don't think I see any more questions. If you have any more, you can type them in the Q&A. Oh, there is one more. What suggestions do you have over the holidays to talk with our students about seeing how they are doing?
Well, I can jump in and throw out a couple of suggestions. The first is to be genuinely curious and open-minded. Your student might not want to disclose everything right away, but being curious and open and supportive can be a really good place to start about how their experience has been. Yeah. I also I'm looking to Paul and Chad who are kind of in that position right now, and feeling very curious how each of you are going to navigate this over the holidays.
Yeah, I think also kind of just checking in with them as far as what are they doing for themselves as far as like are they getting involved. That's always a tough one though, because I don't want my kids to feel like I'm pressuring them to have a similar type experience in college that I had, but also just that genuinely being curious, just kind of checking in. Hey, is there anybody that you've met since you've been there? How is that, going with relationships and different things like that? How are you handling stress? I think can be something, knowing that they're going to be experiencing stress through college. So being able to just kind of sometimes ask those questions, and just, I guess for me too, with my kids, is just being around, just allowing them to initiate conversation, as well. So it's really hard, I know, for me as a parent, not to feel like I'm asking 21 questions when they walk in the door. But allowing them to just kind of have that space to be able to relax, and then just being present, so that if they want to talk, that, they have that opportunity as well.
I think one thing I can add to that is just from the therapist point of view, when we talk about with our students, their anxieties about going home, especially for freshmen, after spending 3 months, 4 months away from home, going home and finding out that their room is no longer there, or their room is taken over by somebody else, or that their things have been moved around and they don't have a place to really stay or privacy that they used to have. And I think that's a common thing that we kind of hear, and I'm sure I think I'm thinking about my own child coming back and saying, I want to make sure that he has his room and has his privacy. So really thinking about those pieces, like we may not think about those things and may not be on our radar, but students who were at home for a long time and gone for 3-4 months and come back and find themselves that they don't belong there anymore. And how do we make that space for them to welcoming space so that they can feel at home and feel welcomed? I think that's one thing that I'm thinking of as a parent.
Yeah, I can add similarly. One of the things that I hear from my clients that they're anxious about going home for the holidays for, and then also that I hear about when they come back, is that they've had their 3 or 4 months of total freedom, decision making, doing whatever they want, but return to an environment with rules and sharing a car and all different kinds of things. So I don't have advice to give necessarily on how to manage that, but just something to consider, that students are returning as adults and they've had freedom and they have survived their freedom and they're coming home to spend time with family and seeing what is the balance of that dynamic now. See, we got a clapping response. And I don't see any additional questions.
Maybe it's time for us to wind this down. And once again, we appreciate your presence and joining us this evening. We really encourage you to reach out to your students, and if they are struggling, really encourage them to reach out to us, the Counseling and Psych Services, and we can be a great support in their journey while they're at Ohio University as students. Once again, thank you.